45. Which of the following is not true of cortisol? A. It counteracts the inflammatory response. B. It promotes the breakdown of proteins to amino acids that the liver uses to convert to glucose. C. It promotes metabolism of fatty acids instead of glucose. D. It is a mineralocorticoid. Correct answer. D. It is a mineralocorticoid. Rationale: cortisol is a glucocorticoid, not a mineralocorticoid. Mineralocorticoids include aldosterone. 46. Which of the following is not true of aldosterone? A. Targets kidney tubules to absorb sodium and water and to excrete potassium. B. It is a mineralocorticoid. C. Causes a decrease in urine volume. D. It causes a decrease in blood pressure. Correct answer. D. It causes a decrease in blood pressure. Rationale: aldosterone increases blood pressure by promoting sodium and water retention, which reduces urine volume. 47. The antagonistic hormone to aldosterone is? A. Atrial natriuretic hormone, ANH. B. Antidiuretic hormone, ADH. C. Cortisol. D. Glucagon. Correct answer. A. Atrial natriuretic hormone, ANH. Rationale: atrial natriuretic hormone opposes the action of aldosterone, promoting sodium excretion and lowering blood pressure. 48. Cortisol is produced by the A. Adrenal cortex. B. Adrenal medulla. C. Anterior pituitary. D. Pancreas. Correct answer. A. Adrenal cortex. Rationale: cortisol is a steroid hormone produced by the adrenal cortex, involved in regulating metabolism and immune response. 49. Atrial natriuretic hormone, ANH, is produced by cells of the A. Kidney tubules. B. Right atrium of the heart. C. Adrenal cortex. D. Pancreas. Correct answer. B. Right atrium of the heart. Rationale: ANH is secreted by the heart's right atrium and helps regulate blood pressure and fluid balance. 50. Hyposecretion of adrenal cortex hormones can lead to A. Addison disease. B. Diabetes mellitus. C. Cushing syndrome. D. Cretinism. Correct answer. A. Addison disease. Rationale: Addison disease occurs due to insufficient production of adrenal cortex hormones, leading to symptoms like fatigue and low blood pressure. 51. Which of the following is not true of Cushing syndrome? A. Trunk, torso, becomes obese. B. Basic blood pH. C. Moon-shaped face. D. Hyposecretion of adrenal cortex hormones. Correct answer. D. Hyposecretion of adrenal cortex hormones. Rationale: Cushing syndrome is caused by hypersecretion of cortisol from the adrenal cortex, not hyposecretion. 52. The antagonistic hormone to insulin is what? A. Cortisol. B. Norepinephrine/epinephrine. C. Glucagon. D. Mineralocorticoids. Correct answer. C. Glucagon. Rationale: Glucagon increases blood glucose levels, counteracting the effects of insulin, which lowers blood glucose levels. 53. Which of the following is not an action of insulin? A. Stimulates cellular absorption of glucose. B. Stimulates cellular usage of glucose for energy. C. Stimulates the breakdown of glycogen. D. Lowers blood glucose levels. Correct answer. C. Stimulates the breakdown of glycogen. Rationale: Insulin promotes the storage of glucose as glycogen rather than breaking it down. 54. When blood glucose levels are low, the what will increase the secretion of what? A. Adrenal cortex, aldosterone. B. Pancreas, glucagon. C. Pancreas, insulin. D. Posterior pituitary, ADH. Correct answer. B. Pancreas, glucagon. Rationale: When blood glucose is low, the pancreas secretes glucagon to raise blood glucose levels. 55. Which of the following is not true of glucagon? A. Produced by the pancreas. B. increases blood glucose levels. C. Promotes the use of fat and protein instead of glucose. D. Stimulates the liver to store glucose as glycogen. Correct answer. D. Stimulates the liver to store glucose as glycogen. Rationale: glucagon stimulates the liver to convert glycogen back into glucose rather than storing it. 56. Identify a characteristic of type I diabetes, IDDM. A. Development has a correlation with obesity. B. Most common form of diabetes. C. Body cells do not respond to insulin. D. Treatment usually involves insulin injections. Correct answer. D. Treatment usually involves insulin injections. Rationale: type 1 diabetes is characterized by the autoimmune destruction of insulin-producing cells, necessitating insulin injections. 57. Which of the following symptoms of diabetes mellitus is correctly matched to its description? A. Polyuria, excessive thirst. B. Polyphagia, excessive ketones in the blood. C. Polydipsia, excessive urine. D. Glycosuria, excessive sugar in the urine. Correct answer. D. Glycosuria, excessive sugar in the urine. Rationale: glycosuria refers to the presence of excess sugar in the urine, a common symptom of uncontrolled diabetes. 58. Which of the following is true of female sex hormones? A. Progesterone is responsible for female secondary sex characteristics. B. Estrogen is necessary for maturation of the ovum. C. Estrogen does not aid in breast development. D. Progesterone helps the uterus to grow. Correct answer. B. Estrogen is necessary for maturation of the ovum. Rationale: estrogen plays a crucial role in the maturation of ova and the regulation of the menstrual cycle. 59. Which of the following is not true of testosterone? A. Growth of the penis and testes. B. Brings about the male secondary sex characteristics. C. Can cause baldness. D. Controlled from the thyroid gland. Correct answer. D. Controlled from the thyroid gland. Rationale: testosterone is produced in the testes and regulated by the pituitary gland, not the thyroid. 60. Which of the following is not a possible effect of anabolic steroid use? A. Breast enlargement in males. B. Balding. C. Severe acne. D. Stunted growth in youngsters. E, A, B, C, and D are all possible effects of steroid use. Correct answer: E, A, B, C, and D are all possible effects of steroid use. Rationale: anabolic steroids can cause all these effects due to hormonal imbalances they create in the body. 61. Melatonin from the pineal gland regulates A. Sleep-wake cycles. B. Water balance. C. Sexual development. D. Both A and C. Correct answer: D. Both A and C. Rationale: melatonin regulates sleep-wake cycles and is involved in the timing of sexual maturation. 62. What is the hormone produced by adipose tissue which signals satiety? A. Melatonin. B. Leptin. C. Thymosins. D. Glucagon. Correct answer: B. Leptin. Rationale: leptin is produced by adipose tissue and helps regulate energy balance by inhibiting hunger. 63. Identify the growth factor that is released by cancer cells to create a capillary network that aids the cancer growth. A. Macrophage colony stimulating factor. B. Platelet-derived growth factor. C. Tumor angiogenesis factor. D. Epidermal growth factor. Correct answer: C. Tumor angiogenesis factor. Rationale: tumor angiogenesis factor promotes the formation of new blood vessels to supply nutrients to tumors. 64. Which of the following hormones does not aid in regulating fuel metabolism? A. Insulin. B. Aldosterone. C. Glucagon. D. Cortisol. Correct answer: B. Aldosterone. Rationale: aldosterone primarily regulates sodium and water balance, not directly involved in fuel metabolism. 65. Which of the following hormones does not help regulate blood pressure and volume? A. Atrial natriuretic hormone, ANH. B. Aldosterone. C. Oxytocin. D. Antidiuretic hormone, ADH. Correct answer: C. Oxytocin. Rationale: oxytocin is primarily involved in childbirth and lactation, not directly in blood pressure regulation.
Thank you for taking the quiz. How many did you get?